A country known for having an abundance of beautiful beaches, home to breathtaking mountains with narrow coastal lowlands. A country said to be blessed by God. Welcome to the Philippines. And in today's video, we will be looking at the history of public health nursing in the Philippines. Year 1912. Fajardo Act number 2156 created sanitary divisions. The president of the sanitary division took charge of 2 or 3 municipalities where no physicians were available. Male nurses were assigned to perform the president's duties, sanitary division. In the same year, the Philippine General Hospital under the Bureau of Health sent 4 nurses to Cebu to care for mothers and their babies. The St. Paul's Hospital School of Nursing in Intramuros also assigned 2 nurses to do home visits in Manila. It gave nursing care to mothers and newborn babies from the outpatient obstetrical service of the Philippine General Hospital. Year 1914. School nursing was rendered by a nurse employed by the Bureau of Health in Tacloban, Leyte. In the same year, Reorganization Act number 2462 created the Office of General Inspection. 2 graduate Filipino nurses, Mrs. Casilang Estaquillo and Mrs. Matilde Azurin, were employed for maternal and child health and sanitation in Manila under an American nurse, Mrs. J.D. Scudder. 1916 to year 1918. Miss Perlita Clark took charge of the public health nursing work staff was composed. 1 American nurse supervisor, 1 American dietitian, 36 Filipino nurses working in the provinces, 1 nurse and 1 dietitian assigned in 2 sanitary departments. Year 1917. 4 graduate nurses paid by the City of Manila were employed to work in the city school. Provinces that could afford to carry out school health services were encouraged to employ a district nurse. Year 1919. The first Filipino nurse supervisor under the Bureau of Health, Miss Carmen del Rosario, was appointed. She succeeded Miss Madel Dubs. There was gradual increase of public health nurses and expansion of services. Year 1923. 2 government schools of nursing were established. Zamboanga General Hospital School of Nursing in Mindanao and Baguio General Hospital in Northern Luzon. These schools were primarily intended to train non-Christian women and prepare them to render service among their people. July 1, 1926. Miss Carmen Leogardo resigned and Miss Genara S. Manongdo, a ranking supervisor of the American Red Cross Philippine chapter, was appointed in her place. Year 1928. The first convention of nurses was held, followed by yearly convention until the advent of the World War II. Pre-service training was initiated as a prerequisite for appointment. Year 1930. The section of public health nursing was converted into section of nursing due to pressing need for guidance, not only in public nursing services but also in hospital nursing and nursing education. Year 1933. Reorganization Act number 4007 transferred the Division of Maternal and Child Health of the Office of Public Welfare Commission to the Bureau of Health. December 8, 1941. When World War II broke out, public health nurses in Manila were assigned to devastated areas to attend to the sick and the wounded. Year 1942. A group of public health nurses, physicians, and administrators from the Manila Health Department went to the internment camp in Capas Tarlac to receive sick prisoners of the war released by the Japanese Army. They were confined at San Lazaro Hospital and 68 national public health nurses were assigned to help the hospital staff take care of them. February 1946. Post-war records of the Bureau of Health show that there were 308 public health nurses and 38 supervisors compared to pre-war when there were 556 public health nurses and 38 supervisors. October 7, year 1947. The nursing division was placed directly under the Secretary of Health so that nursing services can be availed by the different bureaus and units to help carry out their health programs. The newly created section of Puriculture Center of the Bureau of Hospitals had Mrs. Teresa Malgapo as chief. Year 1948. The first training center of the Bureau of Health was organized in cooperation with Pasay City Health Department. Physicians and nurses undergoing pre-service training in public health nursing as well as nursing students on affiliation were assigned to the above training center. Year 1950. The Rural Health Demonstration and Training Center was established by the Department of Health through the initiative of Dr. Hilario Lara, a Dean, Institute of Hygiene, and now College of Public Health, University of the Philippines. In year 1953, Philippine Congress approved Republic Act No. 1082 or the Rural Health Law. It created the first 81 rural health units. Each unit had a physician, a public health nurse, a midwife, a sanitary inspector, and a clerk driver. In year 1957, Republic Act 1891 was approved amending sections 2, 3, 4, 7, and 8 of RA 1082, strengthening health and dental services in the rural areas and providing funds thereto. Year 1967. In the Bureau of Disease Control, Mrs. Zinaida Pandillo Nice was appointed as Nursing Program Supervisor and served as consultant on the nursing aspects of the 5 special diseases, which are TB, leprosy, venereal disease, cancer, filariasis, and mental health. She was involved in the program planning, monitoring, evaluation, and research. In year 1975, as a result of the restructuring of the healthcare delivery system, the functions of the health team members, which are the municipal health officer, public health nurse, rural health midwife, and rural sanitary inspector, were redefined. From year 1987 to 1990, Executive Order No. 119 reorganized the Department of Health and created several offices and services within the Department of Health. In year 1990 to 1992, nurses were involved in the following programs: expanded program on immunization, control of diarrhea diseases, and control of acute respiratory infections. May 24, 1999, Executive Order No. 102 was signed by President Joseph Ejercito Estrada. Based on this executive order, most of the nursing positions at the central office were either transferred or devolved to other offices and services. And that was the history of public health nursing in the Philippines. A generation which ignores history has no past and no future.